Hydroxychloroquine is a commonly used drug in the treatment of autoimmune diseases. Not only are these patients having a hard time getting their prescriptions filled, we're told it's being prescribed to people it shouldn't be.
My joints were really swollen. I was really sore.
It's been 6 years since Elizabeth Wallington was diagnosed with rheumatoid arthritis.
I used to run marathons all the time, and I could barely walk a couple of miles because everything just hurt all the time.
Now a professor. At the onset of her illness, Wallington was working toward her PhD. She wasn't sure she'd finish, but then her doctor prescribed hydroxychloroquine.
I still work out every day, take care of my kid, teach college students, and get around fine.
With the drug being used experimentally on COVID-19 patients, there's now a nationwide shortage. Wallington's 90-day prescription reduced to a 1-month supply.
It's just anxiety producing to know that there is a shortage.
Another woman we spoke to who has lupus says she's gone from pharmacy to pharmacy, piecing together enough pills for the month.
I've had patients that have called 7 or 8 pharmacies to get their refill.
Dr. Carrie Mahorton, a rheumatologist, says for some of her patients, not taking the drug is not an option.
Some people have inflammation around the lining of their heart. Some people have inflammation around their lungs, muscles, joints, the nervous system.
The 41 Action News investigators spoke to pharmacists across the metro. Several told us part of the shortage is coming from doctors who prescribe the meds to themselves and their family members as a preemptive measure in case they get COVID-19.
It's disheartening.
Wallington says if the drug helps COVID-19 patients, she wants them to have it. But for people who don't have the virus, they are drying up the supply.
The idea that I can't get a medicine that I need to survive because somebody's hoping that it works is pretty distressing.
The pharmacists we spoke to tell us they realized something was going on when physicians would call in a prescription for themselves and then call in more prescriptions for people with the same last names, some of whom live out of state. I'm investigator Jessica McMaster, 41 Action News.